Hello everybody and welcome back to the second part of Lupus South Africa and Andrew's Gift Foundation's 4-part series of the most asked about topics in support of Lupus Awareness Month, as you know. So the second topic we are going to talk about is lupus and the kidneys. Yes, systemic lupus erythematosus, which is SLE or lupus for short, can affect the kidneys. So how does lupus affect the kidneys? So you have two kidneys which are bean-shaped and each about the size of a fist, right? So within each kidney, there are about 1 million nephrons, which filter the blood. Blood is filtered to get rid of extra water and waste products. The filtered fluid forms urine, okay? The kidneys are also involved in blood pressure control and in other aspects of health, including producing vitamin D and maintaining a normal blood count, which actually means preventing anemia. When lupus affects the kidneys, it is usually referred to as lupus nephritis. Lupus nephritis causes very large amounts of protein to leak from the kidneys, as well as swelling or edema in the legs, or more generally may develop. For some patients, damage caused by scarring in the kidney means that less nephrons are able to work properly, and this is referred to as a chronic kidney disease or CKD. For patients who develop permanent kidney damage due to lupus nephritis, this usually happens gradually over a period of years, but there may be a sudden deterioration if the nephritis flares up. So how frequent is kidney involvement? About 1 in 3 people with lupus develop kidney disease. Most often this happens within the first 5 years after diagnosis, and commonly lupus nephritis is detected at the same time as the diagnosis of lupus is made. But in other patients, nephritis may develop later on and over a period of time. Younger patients and those from certain ethnic groups are more likely to develop lupus nephritis. Okay, let's talk about the symptoms and the signs of lupus nephritis. So there aren't a lot of symptoms and signs, but lupus nephritis may cause high blood pressure or swelling around the ankles, legs, fingers, or face. However, often there are few or no symptoms and a diagnosis is made from various tests. You can test it through urine testing. Blood or protein in the urine is a sign of kidney damage. These are the early and most important signs of lupus nephritis. Urine should be routinely tested when people with lupus are seen in a clinic or doctor's rooms or even in the hospital. Lupus nephritis can also be tested through blood tests. The kidneys remove waste products from the blood. So if the blood contains high levels of waste products, the kidneys are not working properly and kidney function is deteriorating. Levels of creatinine in the blood are used to measure your kidney function, and this is often converted into eGFR, which allows medical practitioners to calculate an approximate percentage of how well your kidneys are working. Creatinine levels are often normal in people with active lupus nephritis, and an abnormal result usually indicates that kidney damage is already severe. The goal is to investigate and start treatment before this happens. So you can also get a kidney biopsy. A biopsy is a procedure to obtain a small piece of kidney tissue so it can be looked at under a microscope. So this biopsy shows how much inflammation there is and whether there is any scarring to the kidneys. Lupus nephritis is split into different categories from class 1 to class 5. The higher the class, the more powerful the treatment is required. So let's talk about the aim of treatment. The aim of treatment is to dampen down the inflammation and stabilize or improve kidney function. For lupus nephritis, especially class 3, 4, 5, immunosuppressive drugs are used. Common immunosuppressive drugs include steroids or cyclophosphamide, etc. Hydroxychloroquine is another important part of treatment for many patients with lupus. These drugs are also used to treat other features of lupus such as arthritis, but often the diagnosis of lupus nephritis means that treatment needs to be increased to control the inflammation. Okay, so now let's take a look at how the different immunosuppressive drugs are used. So, steroids for lupus nephritis can either be given as intravenous injections directly into a vein over 1 to 3 days, or as a tablet taken daily, which is also known as prednisolone. Mycophenolate is a tablet given on a daily basis. The dose of this is built up over a few weeks, and then monitoring blood tests are needed to check that the drug is not causing any side effects. Rituximab is a newer biologic drug which is given by intravenous injections into a vein. It works by removing B cells which are involved in producing autoantibodies, which causes inflammation in lupus. Cyclophosphamide is a powerful medication used for reducing inflammation and is also usually given intravenously into the vein. So how long does treatment last for lupus nephritis? Most treatment can be given as an outpatient, and tablets will need to be continued for a period of years, often 3 years minimum and sometimes lifelong. Immunosuppressive drugs, like any other drug, can cause side effects, and your doctor and your nurse will talk to you about these side effects. So how do you monitor progress? So regular blood tests, urine tests, and blood pressure checks are carried out to look at kidney function, levels of inflammation, response to treatment, and to monitor for side effects from treatments. These results will be discussed with you at doctor's appointments. A further kidney biopsy may be needed to look at the response to treatment or if the inflammation becomes active again. So let's talk about lupus and dialysis. Okay, so in general, people with lupus do as well on dialysis as those with kidney failure due to other causes. There is some added risk of infection from immunosuppressive drugs with someone when someone is on dialysis. However, this is carefully monitored. Usually, lupus becomes less active at this stage and is often possible to gradually reduce and sometimes stop immunosuppressive drugs once someone with lupus is on regular dialysis treatment. So, a kidney transplant when having lupus. Overall, people with lupus do very well after a kidney transplant. The risk of lupus recurring in a transplant kidney are very low, less than 5%. And in general, transplant medications also keep other lupus symptoms under control. So, pregnancy while having lupus nephritis. Many women with lupus, including those with nephritis, have successful pregnancies. There are, however, increased risk of complications, and it is very important to discuss this with your kidney doctor or rheumatologist before considering pregnancy. It is important that your lupus is in remission before pregnancy. So the conclusion of this video, lupus can affect your kidneys, and it can be minor to more severe effects. It's very important to monitor your kidneys, change your lifestyle, and take your medication religiously. Thank you so much for listening to the second part of the 4-part series, and we will see you next week Friday again.